Good evening. I'm Jennifer Schwartzenberg, the Director of Community Outreach and Development with the Outer Banks Hospital. And thank you for joining us tonight for our Power Over Cancer virtual event. Tonight, we will view a pre-recorded video that features Dr. Charles Shelton, Dr. Christina Bowen, registered nurse Karen Fries, and one of our cancer patients, Kristen Roughton. If at any time during the connection, the YouTube channel is not working, please visit the obh.com/power to get a new link. Hopefully that doesn't happen. This was also referenced in the email confirmation that I sent you last evening. As you view the program, we encourage you to use the chat to type in any questions that you might have for Dr. Bowen, Dr. Shelton, and for Karen. Following the video, we will come back here live to the Radiation Therapy Center, where we will be joined by Dr. Shelton, Dr. Bowen, and Karen to answer those questions. The video will run for approximately 25 minutes, and we're going to begin that video now. Enjoy.
So we're going to talk today to you guys about some of the things that we've been doing at the Outer Banks Hospital. And it's really interesting to be a part of this. And so we're excited today to be here to talk to you guys about just the overall change in our cancer program. So over the last 2 decades, we've really seen profound changes. As you guys know, the hospital was really built in early 2000-ish, 2002. And we looked at some of the cancer data really before that and after that, just to kind of see how much of a change has occurred really since the hospital's been here and since some of our doctors have been here over the last almost 2 decades now.
Yeah.
So it's interesting to see that about 2000-ish, we had a cancer mortality rate that was higher than a lot of areas in North Carolina. In fact, if you look at Eastern North Carolina, we were 4th highest in an area that already has a higher cancer mortality rate than the rest of the state, which is obviously not good.
Right.
So, as you know, we started our cancer program focus back in 2014-ish, 2015-ish. We started looking at our application for COC accreditation. And then we, of course, became accredited in 2016, which was a huge
wonderful
feather in our cap.
Yes.
And so it's interesting to see that since that time, we now can measure the effects of what you're doing and what we've been doing to our cancer program over really the last 5 years. Yeah. So our cancer mortality rate, I'm glad to say now has dropped from much higher than the rest of the state to now actually below the rest of the state in all combined cancers, which is amazing. You're a big part of that. So that's obviously why we're going to talk today about some of the things that we're doing for prevention. Yeah. And I think a lot of this is also education about our cancer team and our cancer services and what we can do for our patients and our population. So I think it's kind of neat, our model. Now, you've kind of really been helpful at developing a model that's, I think of it as kind of the whole person. It's a holistic model that doesn't just think about the science of what we're doing. It's also the lifestyle of the human person that we're taking care of. Right. It's the genetics sometimes that I focus on, and then other times, of course, it's the other part, which is probably as relevant or more relevant than sometimes the science part. So it's fun to think about all of those risks to our cancer population. And all of those risks collectively can be sort of used as a way to model prevention in our community. Yeah. And they can be used to help target how we treat our patients as well. So I think that's really neat. And we now know that about 10% of, maybe 15% of our population have inherent things they've been passed on, perhaps from their parents or from their grandparents, that are risks that make them more susceptible to certain cancers. And, you know, you're born with what you're born with. So you can't change those risks, of course. But as you know, we've learned we can test those patients and we can find those risks, and then we can do things to change those risks and perhaps gear those patients into preventative programs. So I think that's very exciting. The other 80% or maybe even higher, as you know, is really more environmental things. It's things that we maybe not can control perfectly. Right. It's things that might be lifestyle choices that we make or habits that we've developed. And so those are very much responsible for a lot of things we see. And I think it's fun that we've developed a model to help identify those risks and change those risks. So tell us a little bit more about sort of your role in the lifestyle part of this, if you don't mind.
Yeah, I'd love to. One of the things that I think I just want to touch on too that you said, Trey, that I think is amazing is that we really do have a unique program here, in that I love that I get to take the integrative, holistic approach, and that we all work as one unit. So we really do. It's from our oncology care, from chemotherapy, from radiation oncology, from when you get your mammogram. All of it is really a holistic approach to oncology care, which I think is really unique to the Outer Banks and really an asset to our community. And one of the things that I think has been really cool for me to see is utilizing the genetics program and seeing that when women get their mammograms now at the Outer Banks Hospital, we're actually identifying whether they're moderate to high risk for developing breast cancer in their lifetime. And if they are, that they can come and see you and the team for genetics testing and counseling. And then they can also come and see us at the Center for Healthy Living, where we take a holistic approach to helping them on making lifestyle changes that work for them.
So we recognized very long time ago that we have a large percentage of our population that have risks that have not been looked at. And a lot of those are familial risks where family members have had certain cancers that seem to be a little bit more common than you'd predict in the population. And whether that's a rural phenomenon or not, we don't know. But I decided about 4 years ago to get additional training in genetics to see how that would be applicable in what we do for our cancer patients locally. So I took a lot of extra training at Stanford online as I was working here. And that was helpful for me to help really start our genetics program. Now, as part of that, we thought it would make sense to also educate some of our nurses. And we've created what's called a genetics extender program, where we can hire someone and train someone to be a nurse. And we can have that person get additional training in genetics to be both a counselor and also to provide services locally. So Karen Fries is amazing. She was a navigator in radiology for a long time, and I stole her over into our department as our nurse. So she's very excited to become a genetics extender at our program over the next year. She's been accepted to the City of Hope, and hopefully we'll hear her. Let's hear her talk about what she does for us.
Thanks, Dr. Shelton. I've been here at the Outer Banks Hospital for about 2 years now. Originally, I was the radiology nurse across the street at the hospital, and I was navigating the mammograms and our screening low-dose chest CT scans. And now I'm over here at the Radiation Therapy Center working with Dr. Shelton and extending my knowledge with genetics. In 2018, we started using a model called Tyrer-Cuzick model to try to identify women at risk for developing breast cancer over their lifetime. So anybody that's had a mammogram at the Outer Banks Hospital has probably seen this form. And what it does is it asks you pertinent information regarding risk factors, and also will go over a woman's family history as far as breast cancer. If we have identified someone who is at high risk for breast cancer, we can refer her to our lifestyle clinic. We can also, by looking through the family history, be able to tell if she could require some genetic testing. And just most recently, I have been accepted into the City of Hope intensive course in genetics, and I will become a community extender in genetics along with Dr. Shelton, where we will be able to give more and offer more genetic services. We're also hoping to be able to increase our screenings for lung cancer, and that is through our low-dose cancer screening programs with low-dose CAT scans. And anybody that's had a low-dose CT has also seen one of these papers. And you may think that, oh, why am I filling this out? I don't think anybody is ever going to see it. And I have to tell you that I review every one of those forms along with your chest CT scan result. And anybody that has an abnormal result, I will contact you and contact the provider to arrange for care and further testing. We're currently making a difference in cancer education and prevention in our community here in the Outer Banks, and I'm honored to be part of the Cancer Center team that's bringing this to our community. Thank you.
You know, that work that Karen has done is amazing, and the work that she's going to continue to do, especially with the counseling, I think is going to be a huge part of what we're doing here. So I can't say enough about that.
Yeah, and one of the things that I think is so key to the genetics program that you really have built, Dr. Shelton, I would like to give you praises for that, because it's really a gift to our Outer Banks community, because before you developed this program, our cancer patients would have to go off the beach. And now we have a genetics program right here with you that they can have a relationship with their providers as well as their genetics extender. And I know in hearing from patients just how amazing that's been and how beneficial it is to have it right here in the Outer Banks. And so I think that's truly a gift that we're going to be developing that program more and more.
In addition, though, is our program is pretty innovative in a lot of ways. So, you know, for a critical access hospital, which is, you know, tiny and remote, and we're out there, of course, way out in the barrier island of the Outer Banks, for a critical access hospital to be cancer accredited is a rare feat.
Right.
We're one of only 8 hospitals of this size in the country that have reached that type of status, which is amazing. So we're very proud of that. And that's really starting to show in terms of all these metrics that we're talking about, right? So survivals are better, you know, mortality rates are lower, stages are better. So, you know, we did an abstract recently that was accepted to a national organization that basically showed that our cancer stage at presentation for breast cancer was lower by the rest of the nation by 20% prior to our program changes. We're now above the rest of the nation in terms of early stages of breast cancer. So when you see earlier stages, you see better outcomes, you see more cure, and you see obviously a much better quality of life for the patients as well. So we hope to translate, for example,
Right.
but also in prostate and in colon cancers and in melanomas and in lung cancers. And so I think it's a great statement about what we're doing here locally.
Just thinking about when I do see these breast cancer patients, there's the big 5 that I usually talk to patients about. So you know those like the back of your hand because we talk about this stuff all the time. Body mass index of 25, eating a plant-centered diet, physical activity, trying to minimize or eliminate alcohol, and then obviously not smoking. But one of the things that we also know is that along with that holistic approach is we have other things that make up whether we're able to make those decisions in our life and set those goals. So we also look at things like stress and sleep and spirituality. That's important to a lot of our patients here. Connection and who lives at home with you. Where do you cook or do you like to go out to eat? All of those things that really make you an individual person. And so we really try to take an individualized approach to each patient and set goals that are going to work for them, which is why I love our team at the Center for Healthy Living, because it's not just me, it's a whole team of people that make this holistic approach. And Denise DePedro is our health coach. I have a partner, Marielle Silk, who's a nurse practitioner, and then Jackie Hall, who is the dietitian that supports us as well. And so with that team, we're able to help our patients basically their small goals. And as I often tell patients, it's filled with grace, right? So it's a judgment-free zone where we can just come and partner with you to meet these goals that we know, just like you said, you love the science. I love the science around integrative and lifestyle medicine. And the science shows this actually can change whether you get cancer or not. And so that's why we're so passionate here. And you know that. We know that 100%, looking at our data of our breast cancer patients that we've seen in survivorship, 100% of them have met at least one goal and 80% have met 3 goals. That's amazing. And I like to think it's our partnership, but I also think it's the wonderful patients that we get to see here in the Outer Banks. And I think it's just like you said, we're changing the mortality outcomes with cancer in the Outer Banks. And I think that not only speaks to our oncology care, but our motivated patients that we have here in the Outer Banks too, that is such a blessing to get to be a part of their cancer care.
So it sounds very empowering. I mean, I kind of like to think of this idea of, we're kind of giving patients the power to control their own destiny, right? I mean, so we're obviously here to help them through their journey, but I love this model in the sense that it really gives them something that they can do after their primary cancer care to do things to perhaps prevent second cancers, for example.
Yeah. And I think that's, I've talked before a lot about, when I was in fellowship, that was one of the things that was the most empowering to me was to hear the concept of a really big science word called epigenetics. But it really just means that we know 80% of these cancers have environmental factors that are actually the cause of getting cancer.
Yeah, the data we see in my world is that 1 out of every 6 new cancers is a patient who has experienced previous cancer,
right,
and they now have a new cancer.
Right.
And so this is a huge area, I think, where you're making a big difference. You and I have kind of created a really neat model that I think of as a pilot project, I guess, more than anything, where in the breast cancer population, we realized that these women are very motivated to make these changes.
Very motivated.
And we've seen that at least in maybe 100 or so women that we've done this in so far, that I know you've seen over the last 3 years. So far, it's been successful at preventing second cancers. So in that population, I know we've had no patients develop new cancers.
Yeah, true. Yeah.
But I got to think there's other benefits. Like what other benefits could they have from
You're
this?
reading my mind.
Thank you.
That's exactly what I wanted to say.
Yeah.
The thing that I tell patients, I was like, this is so exciting because it's not just cancer that you're preventing. You are preventing, or sometimes even improving, diabetes, hypertension, all those chronic diseases that we know are really prevalent in Eastern North Carolina, Alzheimer's, and just enhancing your overall well-being, and your quality of life. That's what I see with the patients. They'll come in and they say, you know what, Dr. Bowen, I feel the best I've ever felt. And not only is it going to improve those chronic diseases and hopefully prevent if you haven't developed them, it also has exactly what I was saying, a ripple effect. And I know we've seen this in other patients, not just in some of our breast cancer patients, that it often touches the spouse. It can touch your children, and it can touch even friends and other family members to make and encourage them to make lifestyle changes because they feel empowered just by watching you model these positive lifestyle changes.
That's a great point. So we, you and I see probably the majority of our cancer patients here, and that's not like a huge number. Obviously, the Outer Banks is not weird. We have the expected number of cancer patients given our population. But you could almost imagine this would go great in the unaffected population. In other words, the people at risk in our population share the same risks for developing breast cancer.
Yeah.
So tell us where you could see this happening to be useful for women who don't yet have breast cancer. Is there a way to?
Yeah, so I think that speaks to why I think it's just so empowering that the Outer Banks Hospital has chosen to, when women get mammography, that they are going to be now getting a risk assessment, and they'll be doing, we'll find out if they are moderate to high risk. And we will have a program that plugs them in prior to ever having cancer. And they might not have even known they're moderate to high risk. I mean, many people are walking around, they don't know that. And that they have that option to come and see you for genetics, and then to come and see us at the Center for Healthy Living and learn about ways that they can decrease their cancer risk, which is so empowering.
So does anybody come to mind that you can think of that might have benefited already from these services that we provide?
Absolutely. Kristen Roughton is an amazing patient that's had breast cancer. She's somebody you referred to us, and it's been really, truly inspirational to watch her story over the last 4 years. And so I'm excited for us to get to hear from her. All right. Thank you for coming today. I appreciate it. So we are getting to have this wonderful event to tell our community about how they can have power over cancer. And immediately I thought, it's going to make me cry. But I thought of you because as a physician, one of the things that is the most meaningful is when we get to see people change their lives. So tell us your story.
So I was diagnosed in April of 2017 with what turned out to be triple negative breast cancer. I was 38. I went through chemotherapy first, ultimately a lumpectomy, and then radiation, which I did here locally with Dr. Shelton. And that was probably a 10-month process, give or take. I think it took us from May of 2017 through February of 2018 to be done with all of the treatment. And then at the end of the treatment, Dr. Shelton, during one of our appointments, said, I think you would really enjoy meeting with Dr. Bowen. So he made the referral here, and I think I've been seeing you off and on ever since. So It's been almost 5 years. It'd be 5 years in April from the date of diagnosis.
That's amazing. So after you got done with treatment, I think you were right at the end of treatment when I got to meet you.
That sounds right.
Right. Gosh, that means we've been seeing each other for about 4 years. That's what I was thinking.
That's right.
Such a gift to me. Tell us a little bit about what changes you've made, lifestyle modifications you've made that you really felt like empowered you.
I think one of the big important changes that I heard, not just from you, but also from my medical team, was the benefit of meditation. So one of the things I did first, before I even felt like I could accomplish anything else physically, was to do meditation on a more regular basis. So I took the recommendation of one of my doctors who said this particular app, which is the Calm app, was just the one I use. Yeah. And even if I don't use it regularly, it's something I know I can always go to.
Right.
So that was one of the more important things for me early on. I would also say that becoming more physically active was a big and important thing for me, both because it could reduce my recurrence risk and also because I was interested in being healthy, figuring out how to be healthy after everything I've been through. So just being more active and realizing just being more active is okay. It doesn't have to be shoot for the sky every single time.
Yeah.
So those were two really helpful tools. Diet was another. Trying to be more plant-based in my eating and trying to incorporate that for a family of 5 as much as we can, which is not always easy. But all of those things, and trying to give myself a little bit of grace in how I'm able to handle it all, and that it's okay if we can't do it all the time.
That's exactly right.
Mhm.
Well, you hit the nail on the head. This is exactly why I wanted you to share your story. So tell me a little bit more. Those are amazing. How has this impacted your family? Because you mentioned incorporating plant-based eating into your family and then exercise. So tell me how this has impacted your family.
For one thing, it's helped my husband a great deal, and he ended up joining me and coming here for one thing, but also in healthier eating and healthier activity. And our kids just sort of follow suit. If we're active and we're doing, then they're going to be active and they're going to be doing too.
Sure.
We were already interested in them staying as active and playing sports or doing whatever things they could. I feel like we're even more committed to that now.
Right.
In making sure that they're busy, but they're having a good time and they're getting a lot of exercise. We do the best we can with having them eat the appropriate things. They're still younger, but we talk to them a lot more, I think, about fitness and health. And I want you to eat your broccoli because it'll make you stronger and healthier, not just I want you to eat your broccoli.
Right.
Trying to give them a broader picture. We want you to be healthy and fit for your whole life.
Right. It's been amazing to watch for the last 4 years. I remember you starting with meditation and you saying, this is what I got. This is what I can do right now. An increase in your physical activity. And it's been so amazing to see. And I know at our last visit, I walked away and was completely inspired. And I knew other people would be as well. And it's been so amazing to watch the ripple effect that started with you and your husband and your kids. And, that's just going to continue, because it really is one of those things that I tell patients all the time. It can change your stars because we know cancer's 80% is environmental. And it really can change your stars for your grandkids. You don't even think about it like this could be my granddaughter that I'm helping right now with these things that I'm teaching about broccoli or physical activity. So it's so amazing. So how would you say that you feel today after making these changes?
I think today I feel more able to control some things that I thought were not within my control. And I can remember meeting with you once and you telling me you can basically reprogram your DNA. And I thought, that can't be real. But I do believe that is real now that I have learned more and had more information provided to me about what steps you can take to try to prevent recurrence and to be healthier, and that it really is a thing that you can change. Yeah. So I think that's been empowering to know that, and also to know that I have these tools at my disposal, even if I don't use them all the time. I know that they're there and they're things that I can do to try to manage the stress or the anxiety or the worry about recurrence or any of the other normal things that might go through my mind. I know I have resources now. I know I have someone I can ask, can you help me? I'm kind of off track.
Right.
And I know all of that is there. So it's certainly a better sense of control than I would think I felt certainly in the very beginning.
Well, I think that everybody is definitely going to be inspired by listening to your story. Thank you so much for sharing your story with us.
Thank you. Thank you for thinking of me.
I know it's going to inspire others, just like it inspires me every time I think about it. So we're excited to get to share this. And I just think it's going to help a lot of people. I want to say thank you. Thank you. Because, all the things, a lot of what we've heard tonight, I think that, I say this all the time, anytime I talk about our cancer program, you've done so much. And I think that the administration has done so much just to get behind oncology care, and you've helped lead the way in that. But really taking oncology care to the next level in the Outer Banks so that we're nationally recognized with our accreditation and just with the treatment. Our mortality rates are lower. I mean, this is just so neat, the studies that are coming out of our program. And so I just want to say thank you. And I'm honored to be a part of this oncology team.
So the honor's all mine. So you know that to be good, you surround yourself with great people. So we are very blessed to be surrounded by amazing people like you, yourself, Dr. Gunther, the whole team at the Center for Wellness, and our administration is amazing at supporting these services. So absolutely, it's a gift to us all. So thank you.
Three.
Welcome back. I hope you found the video to be informative and useful, and that you can now think about how to use your power over cancer. I'm here tonight live at the Outer Banks Hospital Radiation Therapy Center, and I am joined by Dr. Charles Shelton, Dr. Christina Bowen, and Karen Fries, our registered nurse. We've had several questions come in, and I will start the Q&A. All right, so Dr. Bowen, the first question is for you. What lifestyle modifications do you suggest someone starts if they are looking to live a more balanced life? And the question also continues, how quickly do I need to incorporate changes if I'm looking to make lifestyle changes?
Thanks, Jen. That's a great question. You know, Trey, in thinking about this question, it makes me think about one of the things that we say at the Center for Healthy Living, and I know you say to your patients as well. This is really, truly a journey for our patients. And so you have to think about listening to the video. You guys heard the big 5 that we talked about, trying to maintain a healthy body mass index, physical activity, eating a plant-centered diet, monitoring your alcohol use, and of course, not smoking. So in thinking of those, you have to think about what resonates with you. What is something you'd really like to work on? And start with small changes that feel realistic and set a time for you to make those changes. Because this really is a journey and it's a lifestyle. So it's not something that you're going to do overnight. It's not a diet. It's not a fad. This is what you want to do for the rest of your life to really optimize your well-being.
Great. Thank you, Dr. Bowen. The next question that came in is for Dr. Shelton. Are there certain risk factors for cancer specifically for those that live here on the Outer Banks?
Yes. There are risks that are inherent to certain areas, and there's risks that for whatever reason may cluster in certain areas. And so what we've noticed is, although our environment per se is not any different here in terms of cancer risk, certain factors do cluster geographically in rural communities. So for example, some of those may be socioeconomic factors. Some of those may be things like body weight, where we have a rural population that carries a higher incidence of an elevated body weight, which can impact what we call the BMI or the body mass index. Those are things that can increase the risk of not just breast cancer, but lots of other cancers as well. And then there's other factors that for whatever reason tend to cluster in areas like the Outer Banks. For example, we have a higher percentage of smokers. And that might relate to certain industries, for example. We have a higher incidence of alcohol intake. So while we like our alcohol in moderation, sometimes we see a little bit of excess of that in this region. And there's also familial factors that can come into play as well. And so those are things we can't control necessarily. They are what they are. We're born, to families that we can't control those variables. But we do find that there's a little bit of a higher incidence of familial clustering of certain cancers, at least in the rural areas. And some of that might relate to patterns of how people relocate based on the ability to go outside the area that they were born. Rural families tend to stay within a pretty close distance of their birthplace. And sometimes that tends to cluster some of these risks, at least geographically, in rural areas in particular.
For sure.
Great. Thank you, Dr. Shelton. The next question actually does talk a little bit about familial risk. And this question is for Karen. So Karen, can you tell us how and where you can get genetic testing here on the Outer Banks? And is there a criteria for that testing?
Well, thanks, Jen. And if anyone is interested in obtaining genetic testing, they can reach me at the Radiation Therapy Center, and I will be happy to guide them through the process. I will ask them some questions about their family history and their medical history, and I will guide them through the process of obtaining that testing. Thanks.
Perfect, Karen. Thank you so much. Looking at what I've got here, the next question is actually back to Dr. Bowen. The question reads, do you have any tips for engaging my immediate family members and getting them on board for changing our lifestyle as a family?
That's a great question, Jen, and something that I'm really passionate about because I get to see, to me, it's really one of the sacred spaces of getting to be a doctor. And I've gotten to see that this week in that watching people's family members and their partners come alongside them as they journey in making these lifestyle changes has been so impactful because they feel supported on this journey to lower their risk of cancer for the first time or lower their risk of getting cancer again. And it's been really amazing to see the ripple effect because what we see as those families or partners come along and support their loved ones, they too are getting benefits. So I've had a few patients this week that have actually brought their loved ones in for them to tell me the impact that it makes for them to make lifestyle changes as a family. And as a mom of 3 kids, I have to talk about how do you get your kids to make some of these changes. And I really think it's something Dr. Shelton and I were talking about before this time together. It helps to do this as a family and for your children to understand why you want to do this and eat dinner together. So not only are you supporting their physical well-being, but that's your emotional well-being because we know that connection and that relationship that you'll get at dinner is so very important. And so starting with one meal that you want to have together where you're making those healthy lifestyle changes or increasing physical activity, that's something that we do here in the Outer Banks. We love going to Nags Head Woods and we make it fun. So make these fun if you have little kids. Make it fun and like an adventure. And if you have a partner, it's just great to get to do something together. It's almost like having a new hobby that you get to do together, which of course is going to increase your connection. Anything to add,
I'm
Trey?
going to add a plug for you. So one of the unique things about our area is that we have somebody who's trained in lifestyle risk assessment and wellness. And so you do a great job of customizing a person's risks and helping them see what they really are motivated to do, which I think is great. And it's very unique. So instead of us just saying, hey, here's all the things you can do.
Right.
Go run with it. You do a great job, I think, of saying, hey, what are the things you want to work on as a patient or as a family member of a patient? What are the things that you like to do that we can help you with?
Right.
And that really, to me, gives the power to the patient and the patient's family, which is wonderful. So you do a great job of that. Thank you.
Well, that's very kind of you, Dr. Shelton. I really think you're exactly right, though. It's an individualized approach, and it is not me. It is my amazing team that I have walking alongside and that I get to partner with every day at the Center for Healthy Living. We really have an outstanding group of people that get to the joy of serving the Outer Banks and working with you.
Speaking of walking alongside,
Yes.
Dr. Shelton, would you like to tell our audience about what we have this Saturday going on?
Happy to mention we have a walk and wag event as a Powder River Cancer just fun event this weekend. So instead of just us walking and being part of this amazing adventure to try to improve community awareness, we're also inviting you to bring your animals. And so bring your pet. This will be Saturday. Dr. Bowen and I are going to be part of this as well. And I think we're walking at 11.
Yeah.
The event is pretty much all morning from 9 till noon. So please join us. And you'll see at the end of this talk a way to sign up for that event. So thank you.
Perfect. Thank you for sharing that information. Let's see. The next question actually takes us back to Karen. So Karen, the question for you is, if somebody in my family has a genetic mutation, should I seek out genetic testing?
Actually, Jen, that's a good question. And yes, if somebody in your family has had a genetic mutation, especially a first or second degree relative, it's a good idea for you to get tested as well. Do you have anything to add to that, Dr. Shelton?
So I'd like to add that we're a little bit unique in the Outer Banks in the sense that we have the ability to do these things locally. And I'm proud to say that Karen was recently acknowledged as a nurse and has been invited to participate in a program at the City of Hope to become an extender for genetics counseling and testing, which is awesome to have in a community of this size. So we're very excited that Karen will be part of that genetic testing program as well.
Awesome. Thank you, Karen, and thank you, Dr. Shelton. We're going to stay with Dr. Shelton, and the next question for you is, are there any programs or resources for cancer survivors to plug into and learn best practices from other survivors or clinicians?
So yes, in fact, I like to think that we are a little bit innovative in creating the best practices for survivors. And so we have created a model here that links to a lot of the topics that we talked about tonight, where we have added these lifestyle risks and these other methods of identifying risks into a model that carries forward not just after the treatment or during the treatment, but into the whole period of what we call survivorship, which is really from here until the rest of your life, right? So I love the fact that we've created a system where we invite the patient to participate in that. We then help customize and create these goals that Christina does such a wonderful job of doing and customizing. And we essentially then make the patient proactive in their own care.
Yeah. Yeah, and it's really great. Exactly what you said. We invite them to join, and it's so powerful to see how they choose to make these lifestyle changes. I know that you guys got to hear from one of our patients, Kristen Roughton, and I started getting upset because it's just totally inspiring to see all these wonderful changes that our patients are making, and that their families end up making too a lot of times.
So we've taken this model a step further. You and I have talked about creating a clinical sort of a research study, because we believe in it so much that what we've created really is a novel approach to having patients enroll in a survivorship model of care that we call the Survive Well study. And so tell us what that's going to involve.
So the Survive Well study is exactly what you're saying, Trey. So survivorship is part of a cancer plan. And usually all of our oncology patients here at the Outer Banks Hospital would get that. And I like to think we did a great job with that. And each year they would follow up with their oncologist. And we have seen that we want to take it a step further. And we really want to invite our patients to come and participate in a study called Survive Well that will actually follow them for 5 years and along their journey with these lifestyle modifications that we know science shows is going to decrease their risk of a cancer recurrence. So I'm super excited that we're going to be leading the way, really, for our cancer patients here in the Outer Banks and hopefully for Eastern North Carolina.
Awesome.
Great. Well, I have gone through the questions that were emailed, and I'm not seeing any more in the chat. So before we close our program, I am going to ask Dr. Bowen, can you share with us, there's some books that our audience will be receiving as part of their participation today. Can you tell us a little bit about those books?
I would love to.
Thank you.
So the first book, you're going to get to choose which book you would like to have. And these are two of my favorite books. And the first one is Self-Compassion by Dr. Christine Neff, who's one of the leading researchers in self-compassion. And I love her work. And the reason that I chose that for tonight is because I know that the first step for making these lifestyle modifications is really to have compassion for yourself and really believe that you want to treat yourself kindly and that you're worthy of making these lifestyle changes, because you are. And we believe that. And so I really wanted people to have this, and just a lot of really wonderful tips from Dr. Neff in here. And then this is my favorite cookbook. And I need to give a shout out to my sister-in-law in Utah who introduced me to this. Thank you, Dolly, for this. Love and Lemons Every Day. And this is a plant-centered cookbook that I have loved using. My team at the Center for Healthy Living, we all love it as well. And so you'll be getting to receive one of these two books. I'm very excited about that. And as you know, plant-centered eating is the way that you want to eat for us to decrease our risk of cancer and decrease risk of cancer recurrence. I also wanted to share with you that you'll be getting something that I think was beautifully designed by our team here at the Outer Banks Hospital, called your Cancer Prevention Action Plan. And so just like you were discussing, Trey, they're going to get a sheet that is going to help them individualize the lifestyle changes that they feel they're ready to start making and setting those small, attainable goals that are time sensitive, called SMART goals. So they'll flip over to the back and you can actually write them down. And you're 80% more likely to do something if you write it down. So I really challenge you to write it down.
Wonderful. Well, thank you. I'm checking the chat one more time to see if there's any more questions. It does not look like there are. So that will conclude our program for tonight. Thank you, Dr. Bowen, Dr. Shelton, Karen. Karen, good luck tomorrow as you begin the City of Hope Extender program. We're very proud of you. And thank you to all of you for taking steps to get your power over cancer. We hope to see you at the Walk and Wag this Saturday. And on behalf of everybody here tonight and the Outer Banks Hospital, thank you so much for joining us.